Dr. Wong will start by providing you with an overview of the global and domestic COVID-19 preparedness efforts.
Thank you. Canada's public health system is prepared. The Public Health Agency of Canada, along with public health authorities at all levels of government across the country, have been working together. The Public Health Agency of Canada is working with provinces, territories, and international partners, including World Health Organization, to actively monitor the situation. Global efforts are focused on containment of the outbreak and the prevention of further spread. The federal, provincial, territorial public health response plan for biological events has been activated to ensure a coordinated response across Canada. The provision of health services to Indigenous peoples in Canada is an area of shared jurisdiction. Under the Canada Health Act, provincial and territorial governments provide insured health services to all of their residents, including First Nations and Inuit.
It is important for us to work as one system and to work in a coordinated, collaborative, and transparent manner, particularly with respect to Indigenous Services Canada. We recognize the particular geographic, systemic, and policy-related challenges that can be faced by Indigenous communities and specifically First Nations, Inuit, and Métis, who may have more limited access to healthcare service providers as well as other social determinants of health challenges. The Government of Canada is generally responsible for the provision of services for First Nations on reserves across provinces in Canada and provide primary care services in remote and isolated First Nations communities where there are no provincial services available. There is a distinction in British Columbia where in 2013, the British Columbia First Nations Health Authority took over responsibilities that were previously held by the federal government for those primary care and public health services across all First Nations communities in BC. We also support the delivery of public health and health promotion services on reserve and in Inuit communities in Inuit Nunangat. And in addition to that, Indigenous Services Canada funds drug, dental, and ancillary health services to First Nations and Inuit, regardless of residence, through the Non-Insured Health Benefits Program. Our relationship with Inuit is different in that we fund territorial governments, land claim organizations, and self-government agreements, and so our role is primarily that of a funder. We do co-chair the Métis Health Committee with national and regional Métis representatives, Health Canada, and the Public Health Agency of Canada, and Métis continue to receive services from provinces and territories directly.